Hello, I'm Raj Chengappa, and I'm at the headquarters of the Serum Institute of India in Pune. Serum Institute is the world's largest vaccine manufacturer. And on COVID vaccines, it has done a sterling job. It has produced over 1.3 billion doses already. And for those of us in India, it is known as Covishield. And I have the pleasure of and the privilege of interviewing Mr. Adar Poonawalla, the Chief Executive Officer of the Serum Institute of India. Adar, thank you for being with us.
Pleasure to be here and talk to you, Raj.
Adar, let's begin with this whole thing when COVID began in March 2020. What was the challenge? What went in your mind? You were sitting here and suddenly this huge pandemic breaks out. Were you prepared? What went into your decision making?
Well, when the WHO, classified this as a pandemic that's going to potentially cause disruptions to travel and, result in this virus, spreading and creating havoc all across the globe, we had two choices. Either sit and wait as a manufacturer for a technology to prove itself or a vaccine to be licensed and then try to enter into a collaboration with someone or, partner with multiple different innovators in academia such as Oxford and then Novavax and some others to start building facilities at risk and then stockpiling production at risk. Of course, that came with a lot of challenges. Every month there was a new challenge, whether it was raising capital, partnering with these people, getting your permissions and licenses, and then even after we were licensed, there were challenges on supply. The country needed a lot more, a lot faster when we were hit with the second wave. So we've encountered all these challenges, we've overcome them, and now India is in a very good position. In fact, globally, the supply of vaccines from other manufacturers also and in India has outstretched the demand in the sense that, yes, the demand is very much there. We need to vaccinate large parts of the population still across the globe, but at least there's enough supply on a monthly basis to take care of that.
Now, you took huge risks. At the time that the pandemic began, no one knew anything about the virus. They were still working on it. And normally vaccine technology takes 5 to 10 years to gestate and get into production. What went into your mind? Why did you tie up with Oxford University, AstraZeneca? Why did you want to do something yourself? What was the decision making? And you were making huge investments. What was the kind of investments you were making at that time?
They were already ahead. They'd already conducted a phase 1, and for us to develop something on our own would take a lot of time. We already had a relationship with them because we're developing and going to manufacture the malaria vaccine, which we'll launch in 2 years. So we already had a working relationship with them. So they were the obvious first partner to go to when we heard the announcements also and were talking to their team. Initially we invested $250 to $270 million. Very soon, by May, June of 2020, I realized we needed close to $900 million to $1 billion. Because if we were going to make all these other different vaccines also to the scale of 1 billion dose capacity annually, we needed to put in that investment. And also buy the raw materials and the OPEX that was required. We hired 1,000 people just for the COVID activities, trained them. So all this was happening in 2020. Whilst in parallel the clinical studies and trials were going on globally and as well in India.
Now, what are the skill sets? I mean, for the ordinary person, you just see the vial and you think, yeah, okay, we'll take it. What are the skill sets required to manufacture a vaccine like this, particularly in the midst of a pandemic? It's not like a normal period that's there.
Well, it's a very specialized process.
Right.
It's not just, the average pharmaceutical product that has to be made. You've got, with a biological, so many different challenges when you do the bulk production. The yields, the consistency, the purity levels that you need to achieve. And then, of course, when you fill and finish the product, it has to be particulate free. It has to conform to all the parameters. I could write an essay on it, but I won't go into it today. So it is a very niche area. That's why you wonder why there are such few vaccine producers in the world. It's not something anyone can tomorrow just get into doing. That's why even globally, there have been vaccine plants that have been shut down because they've not been able to maintain the quality standards or make those plants profitable. Because again, don't forget, we work on a very low margin, but it's the volumes and scale at which one operates at which would determine your profitability.
And what makes Serum Institute the world's largest? What is the USP that Serum Institute has?
Well, I wouldn't call it a USP. It's just been my strategy, at least since I took over in 2011. I've been doing this now for 20 years when I joined the business, and my father founded it in the 60s. Since 2011, 2012, I've been building capacity ahead of time for all the vaccines and new vaccines that we were going to launch. And that really has come in handy here during the COVID crisis, because we were able to use those facilities, quickly rejig them, buy new equipment to just install the specific equipment we needed. And the world has always underestimated how much vaccine it needs with the growing population, in all these areas that we operate in, these 170 countries. And it was just our future planning that I always took that, I wouldn't call it risk, but just future planning, so to speak, that enabled us to be able to make so much so quickly.
And did you ever imagine that a pandemic of this would happen? What is,
No, look, there's always been debates on, epidemics and outbreaks coming about. You had the flu outbreaks. It wasn't really a pandemic in 2010, 2011. We made a flu vaccine also. But then at that time, as the need sort of went down, it wasn't a product that people wanted to keep vaccinating against, which, is done traditionally in the West, the Western countries. Having said that, then there was the Ebola outbreak, and we always assumed that there would be these outbreaks. You have even measles outbreaks in certain parts of the world, where you need to then rush vaccines, and you want to be able to vaccinate the entire population of some of these countries which have very large populations. And in order to do that, you have to have large capacity, and you need to have, you need to be able to rapidly produce and supply. That really is our USP, and that's how we're able to deal with these large needs and outbreaks. Of course, we could never imagine a global pandemic of this nature. You only see that in the movies. But as Bill Gates and many others have said in the past, you've seen that with the flu epidemics and plague and other things years ago. We haven't experienced anything of this magnitude, and there's nothing to say that it won't happen again. So we really have to be prepared, and the world has learned a lot of lessons, including in manufacturing, regulatory harmonization, so many other things. Hospitals, health systems, oxygen supply, all these things that we've learned will play a major role in reducing the casualties and trauma, even to the economies going forward, if God forbid there are future pandemics. And God forbid if there are waves that come about, the third, fourth, fifth waves in certain countries should not devastate to the way in which they did earlier on with the first and second waves, because now we're better prepared.
Now, with the government of India, you've been working with them. What is it that, what is the kind of support that they were giving you? And, how has that made a difference? And what is your sense of what needs to be done now? You said there were some lessons that had to be learned. From this experience, what would you say the government needs to do?
No, I think we've worked very well together, despite what you may have heard in the media. We've had an excellent relationship. The bureaucrats, ministers, we've planned everything out as best we could have. I think some of the lessons to be learned is do things in advance. Don't wait till it's too late. And I think we have an excellent relationship, where a very close relationship where we discuss what should be done, and then we let the science decide the decisions. For example, even right now, we're discussing whether to have a booster dose or not, and how to go about that strategy. Again, the science and experts have to decide that, and we await the directions from the government. So, whether it was capacity planning, whether it was distribution, to the entire country, it's a huge effort of coordination and logistics that needs to happen. And, I just think we've worked very well. All I can say is that I hope this momentum continues post-pandemic. It's been a year.
Right.
You give us time, and the industry is going to come out with better innovations to handle it, so that, you don't have second, third, fourth waves, creating havoc. And, that's the direction we're going in, which is great news.
And for all of us, I've taken Covishield itself. The concern is that, is it now protecting me against Omicron? Is it the Delta variant? Any of these things come, do I still have the immunity that is there?
There is no reason to believe that the vaccines that are licensed today, not just Covishield, but the others as well, will not protect you against Omicron. Today, the information out there and data is still coming in. That's why I'm not making a definitive statement. Will it be to the same extent as it was with Alpha and Delta variants? We don't know. But we know that, for example, in the Lancet study recently, the Delta variant was being neutralized as far as severe disease is concerned with Covishield to the tune of 81%. So we don't know about Omicron. When the data comes up, I think the world will know. But all the vaccines are being tested against Omicron, and we'll know very soon how effective they are. And look, if they come down to 40-50% in their efficacy, then that's when you boost. That's the whole idea of boosting.
Right.
Until you get new vaccines which are specifically tuned to dealing with Omicron, which even Oxford is working on and AstraZeneca is working on. But if the need arises in 6 months, 7 months, we need to launch such a booster vaccine, we can do that.
And finally, some personal questions. 1.5 years from March 2020, even longer. What was the stress that you were under, and what were the big lessons personally you learned?
Well, every week was, as I said, a new challenge, and especially with the media scrutiny of, I don't think even any listed company would go through the kind of scrutiny which we had going through in terms of every permission, every milestone, every situation. And that was fine because, we took that in our stride, and whether there was criticism, whether there was clarifications that were sought, it wasn't just that. It was just getting all this done in record time. And we knew we had to do it because every month lost was, going to result in lives that would have been lost. And that was the only thing driving me at the back of my mind and my team here, and the 8,000 people here that have worked tirelessly. Without them, implementing my objectives and my targets and my strategies, we would be nowhere. So, we must acknowledge that. I think the lessons were learned that nobody should make any forward-looking statements. That's why even when you ask about Omicron, I'm very guarded in that. In fact, I've never made any forward-looking statements except for my manufacturing capacity and capabilities, which we've done and in fact surpassed. We always said we'll make 1 billion doses. We've made 1.3 and delivered that before even December. So, I've stuck to whatever I know and whatever my expertise has been. I think the lessons have been that, we need to work together, and there's nothing we can not accomplish if we all work together in terms of government, academia, industry, and all of that. I think we've all learned so many lessons. We could write a book on it. But I think these were, to name a few.
And when you talk to your wife and 2 sons, I would gather, what do you tell them, and what is their questions to you? I mean, it's just curious. It's a little personal sort of touch.
They've been with me during this journey, and they've never seen me, I think, work till 10, 11 at night. Time with the family has been challenging. In fact, that's what I've now been enjoying is my family time, which, was deprived at that time where I had to focus everything on this. They've learned so much also. My children have also learned. They ask me so many questions.
What is the questions does your son ask when you're, which struck you when you
said my 12-year-old asked me, but after all this, and he asked me this in December last year, so since you asked me this question, what would happen if Covishield doesn't work against this virus? What are you going to do then?
Wow.
So I said, then I'll have to look for another job and we'll have to find something else to do. But luckily in January we were licensed.
Right.
It was working, and look at, and now we discuss that look at the cases that have been reduced and the hospitalizations from early parts of 2021, which is when we started vaccinating in the large scale, to now. And you look at some of the other vaccines used, let's say in Germany, in the US, they've not been able to control those waves and infections to that extent. This is a testament to both Covaxin and Covishield, which have really helped in bringing down the severity of the disease in our country, which is what I call real world data. These clinical trials give you some sense of what's going on, but real world data is what really matters when you can bring down hospitalizations, infections, and all of that, breakthrough infections and all of that. So I think, we're in a good place.
And your son is Darius, so who asked you that question?
Cyrus, my elder son.
Okay. And did he now, or did Cyrus, Darius say anything in the last year and say, Dad, what's the latest, or ask you?
No, he's just happy. He's only 6, and he just he keeps asking, but when is this all going to end? When are we going to defeat coronavirus is his question, but
And what do you tell him?
I think time will tell. In a year or two, I've told him that everything will be okay.
And what do you do to chill out with all this thing? What is your favorite pastime? What do you read? What do you
Well,
like
I
to
haven't
do?
had a lot of time to read, but I do like to play tennis. It's a great form of
You look
exercise
very fit
too.
also. You do.
But tennis is a great way to just switch off and get some exercise in. And I play with some friends. That's one good way. And just in the evenings, watch a few movies and TV shows if I get the time just to unwind. So, last year was, and even the better part of 2021 was just focused on just delivering what we promised, and getting all these other vaccines on track, and also, by the way, maintaining the vaccines that we were making for pneumonia, rotavirus, and the other diseases that takes a toll on child deaths and mortality across the globe. And it was very important that during this pandemic, those vaccines are not ignored, because those death rates, which also go into millions in children under the age of 5, were very important to us to address as well.
Well, Adar Poonawalla, thank you so much for this. I think in terms of not only the Serum Institute of India, your personal contribution, helming the entire strategy for Serum Institute of India, and ensuring that India gets not only adequate amount of doses, effective ones that are there, and now looking across to the world. For all these reasons, Adar Poonawalla, you are India Today's Newsmaker of the Year. Congratulations very much.
Thank you. Pleasure. Pleasure.
Thank you very much.
Wonderful. Shall we get rid of the mic?
Yes.
We shouldn't go back to the way of doing things where we take a long time to get clarity on permissions and licenses. I just hope, and this is what I always joke around with my bureaucrat colleagues and friends and ministers, that let's continue this momentum, because India has so many opportunities that the world wants to invest in as an alternative to China and other locations, given our skill base and our talent and the environment that Modi ji has created. And we must take advantage of that going forward post-pandemic. So I think that's what government can look at, how to simplify policies, improve further permissions and licenses that can come fast. We didn't cut any corners, we just got everything done so much faster, and that's what I want to see going forward in the years to come.
No, and that's a very good point that you're making. You made Serum Institute the vaccine capital in some senses of India and the world. How can we make India, the country, a vaccine superpower? What would be the 4 or 5 things you would say, okay, we've got all this, what do we need to do?
Well, I think we've already achieved that in some way. As you know, 60% of global vaccine supply, or 70% of global vaccine supply globally, comes from India. Now, how do we go up the value chain so that we can have our own research, our own innovation? We need funding for that. And for that, you need to be able to make a decent profit. In India, unlike the US or Europe, it's frowned upon if companies grow beyond a certain size and make profit. But these profits are ultimately going to be used for what? Reinvestment in capacity and innovation in this country. And I think as we understand that, the pricing policies, the environment in which you can get your permissions and licenses faster, to build new factories, to innovate, to plow back in research, to incentivize further, for exports. These are the sort of things that will cement our place in the globe as a vaccine superpower, and we're well on our way to doing so. And I must again thank the government of India in helping us realize that dream and objective. And I think the next 10 years is going to be the golden age for the vaccine industry in India, and we just have to make sure we can take advantage of that.
Now, one of the things that you had recently mentioned, that there is a in terms of orders. The government has not placed fresh orders, and you are producing at the rate of, I think the last count was some 500 million doses were available here. What do you think needs to be done now? Because you also talked of possibly even shutting down some of your units that was making Covishield.
No, let me clarify.
Right.
So, the capacity is there.
Right.
If the nation or the world needs more, we can immediately, produce it. I'm not using those facilities for anything else. It's just that we have already 500 million doses, which is 50 crore doses in stock here. And I can't store any more. So all I did was highlight the good news that India has reached a certain level of vaccination under Modi ji's guidance and vision. And now, the country is only trying to vaccinate as it should on priority 2 doses of, for everyone. Double vaccination is really the key, and eventually maybe a booster if the government and the experts feel it appropriate. So all I was highlighting was that we have the capacity, but the output we've just fine-tuned and reduced a little bit as we get more orders from exports and other places. There is no point in continuing producing, labeling, packing 250 million doses. So there's no reason to panic. It's only good news, in fact, that we don't need any more vaccine in the country. We've got the stock. Other manufacturers have also scaled up so much. So, we're in a very good position now, even if we need to rush more vaccines as booster doses or, third doses, for anyone, we can do that. So that's all I was highlighting. So that should not be sort of misinterpreted.
Sure, but you touched upon a very good point in the sense that while we might have all the doses we require and probably more, we see that the world, particularly the poor countries in Africa and other places, still are not vaccinated to the extent we have.
But they're getting there. Yes.
Yeah, so I wanted to ask you, in terms of, you are also a member of the Global Alliance for Vaccines, Gavi. What do you think needs to be done now if we have to reach, because that's where the next big challenge we have, right? We might have done the West world.
To get everyone vaccinated.
Yes.
No, look, I think they're doing a great job. The African nations have been very supportive, and Serum Institute has always prioritized, the LMICs, which is the low and middle income countries. They are getting a lot of vaccine doses from various sources and manufacturers, which is again great news for them, and I'm so happy. And all I said in the recent announcement was that exports are now open. India is the pharmacy of the world, and it was known as that, it is that. And we want to play our part as Indian vaccine manufacturers, as the whole industry, to support you in as many doses as you want. They are placing orders, and we see that this gap which remained where African nations were only at a 10% coverage, I think that's going to exponentially grow, and hopefully by the end of this year they will have reached a 60-70% level at least of vaccine coverage, and we just want to play our role as Indian vaccine companies to support them in doing so.
No, and that's very optimistic to look at, but if you see what's happened recently, and Omicron is an example of that, all of a sudden you thought we had sort of taken up all these challenges, and so what do you see as the fresh challenges that Omicron and any other mutations would come, and what, as someone who's an expert in this business, what would you like?
That's what the experts had always said, that this is why it has been absolutely vital and essential to vaccinate and double vaccinate so as to prevent spread. You see, when the virus spreads, it gets an opportunity to mutate.
Right.
That's how these different variants come about. And of course, with Omicron, the best strategy is to first get double vaccinated, and perhaps for your vulnerable, and elderly category of people and healthcare workers globally, you go for a booster. Most countries which have got excess stock in the West of vaccines, which now even India has, have taken and adopted a strategy of boosting based on various factors. So again, I'll leave it to the experts to suggest how to go forward in it. I don't think there's any debate that a booster is required, but to whom, to which one, and where, and how, I think that's what we are waiting for the government to decide on, and they should take their time and discuss with all the experts, which is what they're doing, and we'll get a decision very soon.
Now, finally, towards the, one wants to understand, in terms of you made Covishield, what are the other vaccines that you're making for COVID vaccine itself. You've tied up with Novavax. Plus, you were working on an indigenous vaccine as well that you're going to do here. What is the status of those vaccines that you're doing?
So, you know, when the second wave came, we sort of put in all our capacities and efforts with the licensed vaccine of choice, which was Covishield. Because that was proven, it was well accepted, including for travel. You know, it took us months to get it approved everywhere for travel. So, you know, the best strategy was to maximize the output on that. Novavax should be licensed in a month or two. It's got excellent efficacy data even against variants, which is good news.
It's an injectable?
Yeah, of course.
Yeah.
And also it will be the vaccine of choice that we will launch in 5 months for children, all the way down to the age of 3. So that's our strategy for children. I know a lot of people and parents have been anxious for that. And of course, we're going to be making some Sputnik Light if it gets licensed soon. And our fourth vaccine, which is a nasal one, again developed in partnership with Codogenics, and that's the last one, which will take at least a year to be fully licensed, is a live attenuated vaccine, which probably now will be a booster vaccine, which being live attenuated with the entire virus will be an excellent vaccine to cover all variants, no matter what variants come about in the future. And we always knew that variants would come about. So we adopted the strategy around that for the future, going ahead, looking at the next 3-4 years. And again, being a nasal vaccine, the advantage is that, you know, you protect the mucosa and this part so the virus doesn't get an opportunity to infect. Today, sadly, you know, there's a 50% chance if you're vaccinated, you could still get infected. Or at least get infected and you know, pass it on and spread the virus. The hope and the objective of the nasal vaccines is that you reduce that to a large extent as well.
So that's the next big thing in terms of vaccine technology that we're looking forward to.
All these second, third generation vaccines will be better against variants. They'll have better ways of administration.